The number one thing that people come in for Botox treatment with is the vertical lines between their eyes, or the 11 lines as some people call them. Other areas that Botox can be very effective include crow's feet and other fine lines in the face, as well as underarm sweating, and the treatment of headaches. Migraine headaches can really respond to Botox. So we use Botox for a lot of different things in our practice. People are often very surprised by how easy a Botox treatment procedure is. The needles that are used to inject the Botox are very, very small, and the most typical response that I hear after doing a Botox treatment for the first time is for the patient to say, "Is that all? Have you really done it?" Because they can't believe that it was as easy and simple as it is. Downtime or things that can happen afterwards, the vast majority of people will have no difficulties after the treatment at all. Rarely there will be a very subtle or small bruise that needs to be covered with concealer, but even if that happens, it's usually a very faint and small bruise. So we usually don't have trouble with people having other people noticing that they'd had something done and that sort of thing after the treatment. It is important to remember that it takes 3 to 7 days for a Botox treatment to take effect. So after you leave the office, when you go home and look in the mirror, you're going to look the same that night because your treatment will not have kicked in. So we just always tell people, wait anywhere from 3 to 7 days to see your full effect before you become concerned that you may need to be retreated or boosted. The best thing about Botox is that it is a very easy procedure to do. It doesn't take very long, it's not uncomfortable, and the results are consistent every time. People are very, very happy with their Botox treatments. Oftentimes, one of the first things that people come in concerned about with their aging skin is the development of parentheses, or these lines between their nose and their lips. And one of the best things that we can do to treat that is to use filler to give that volume back. So one of the things we do is that we sit down and look at the changes that are happening in a person's face and look at each person individually and determine which is going to give them the best result for the least amount of investment so that they can make a good choice. Some people will require numbing for fillers, but most people don't. Fillers have numbing medication built into them so that makes it much more comfortable. Typically, we just go ahead and get the patient prepared and we clean the skin very thoroughly, and then we inject the fillers into the area. It only takes 15 to 30 minutes for most people, depending on where we're injecting the fillers. Sometimes after the treatment, there can be some bruising or some redness to the area, but it's perfectly acceptable to put makeup on right away, so you can use some cover-up or concealer if you do get a bruise. The best thing about fillers is that you have immediate results. And so people walk in and then they walk out and they tell me, "I look like I got a good night's sleep," or they can see immediately what they've done. Laser hair removal can benefit anyone. We're able to treat all areas of the body, and most commonly, people will say afterwards, "Why did I not do this a long time ago?" We offer several choices for hair removal. We have laser hair removal and electrolysis. We offer both choices because each one is perfect for a different group of patients. Having both choices allows us to treat and manage people with all skin colors and all hair colors. Laser hair removal is ideal for people with darker hair and lighter skin. When we get into clients who have blonde hair, light brown hair, strawberry blonde hair, then those patients need to use electrolysis. Both procedures require repeat treatments. For full results, you're going to need, for laser hair removal, at least 5 treatments, and those will be spaced anywhere from 4 to 10 weeks apart depending on the body part. For electrolysis, you will also need a series of treatments, and those can be spaced more closely together than laser. How many treatments you need with electrolysis is going to depend on your hair density and how much hair you have. Laser hair removal treatments are very, very quick. We use very cold air blowing on the skin to help protect from discomfort, but there is a little bit of discomfort. Electrolysis is generally considered to be a fairly comfortable treatment, depending on the area that you're treating. Both types of hair removal are going to be more uncomfortable in sensitive areas like the upper lip. The best thing about laser hair removal is that it's highly effective and it's long lasting and people love it. Oftentimes people come in with concerns about the texture of their skin. Things like acne scarring, stretch marks, changes in the texture with aging and with fine lines and wrinkles, and we'll often use microneedling to help them address that. An example is this young lady who came in with acne scarring that she'd had since she was a teenager. And having tried all the other treatments available, we decided to use the microneedling on her, and she got excellent results after just one treatment. It uses very, very fine needles to penetrate the skin to the depth of the collagen level, and that little bit of penetration to the collagen stimulates new collagen to grow underneath the skin. Well, we numb people before the treatment so that they'll be comfortable. We typically will have people numb for about 20 minutes, and then we will begin the procedure, and the procedure will be adjusted depending on where we're treating. So we have different abilities to treat deeper or more shallow depending on where we are and what our target is. We then take the microneedling device and very smoothly move that over the skin. The microneedling device is basically vibrating those needles back and forth at a very, very quick rate, so in a very short amount of time you get many, many episodes of treatment. We can treat any part of the body. Many people will see results after the first treatment, but you typically are going to need at least 3 treatments to get to your full result. So we usually do packages of 3 or 6 treatments depending on what we're targeting. The best thing about microneedling is that it is an affordable alternative to other collagen stimulating treatments. When people come in telling me that they feel old because of jowling or sagging of the skin around the neck, we often suggest Ultherapy. Ultherapy is an ultrasound-based skin tightening treatment. It is used to help lift and tighten the skin of the neck and the face. It is the only FDA-approved alternative for a facelift. It's a treatment that uses ultrasound to stimulate collagen growth beneath the skin, and that new collagen growth creates lift and firmness in your skin. The treatment itself typically takes about 3 hours. The results will be complete about 4 to 6 months after that treatment. It's a non-invasive, no downtime alternative to a facelift, so it makes a really good choice for people who aren't quite ready for a facelift or who don't want to make the investment or take the time off from work that's required for a facelift. Ultherapy is going to give you a more subtle, natural result. It is going to have very little downtime. Occasionally we'll have someone who has a little bit of bruising after treatment, but that can typically be covered with makeup, and people will go to work the next day and not have any untoward effects. The best thing about Ultherapy is that it offers an alternative for the lifting of the skin of the face, neck, and décolleté without surgery. People come in for vein treatment for their legs, typically when they suddenly realize that they're uncomfortable wearing shorts and skirts. On the face, it's a little bit different because a lot of times people are finding themselves embarrassed about redness. Well, we offer both laser and injection sclerotherapy for treatment of spider veins and superficial leg veins and face veins. We decide which is the best treatment based on the location and the depth and the color of the veins. The treatments are typically fairly comfortable. There's more discomfort with laser treatment than there is with sclerotherapy. A lot of people who have had sclerotherapy in the past have complained about the discomfort, but newer sclerotherapy agents are on the market now that allow us to do this with very little discomfort at all. The results happen fairly quickly. There can be some bruising with either type of treatment, and so that will heal in the same timeline as a typical bruise for a patient. There are many reasons why we would choose laser versus sclero or sclero versus laser, and the type of veins that you have is one of them. Another factor that we consider is that compression stockings need to be worn after injection treatments, and they don't need to be worn after laser treatments. So sometimes when people want to have some veins done in the summer, that may be a factor that would steer us towards using the laser instead of the injections. The best thing about facial vein treatment is that the effects are almost immediate and there is not a lot of downtime. So when we treat those veins, they're gone the next day and people are going around without makeup and they love it. And with leg treatment, it does give women the confidence to wear their shorts and skirts again.